Hi, my name is Dr. Atasha Jordan, and I am a Caribbean-born, Harvard and UPenn trained Christian psychiatry resident. I know that's a lot, but I am a physician who loves Jesus, and I want to help Christians be able to learn more about mental health. If you found this video, that means that you're either searching as a Christian or someone who is seeking God. You're searching for ways to maintain your mental health on your spiritual walk. Or maybe someone shared this video with you because they thought that you would benefit from the things that I have to share. I feel that my calling in this world, God has called me to be able to help the Christian community to really understand that mental health and mental illness can exist in the church. It does exist in the church, and we can get cures and treatments for it in the church by utilizing both faith, medication, and therapy. So if that sounds interesting to you, hang around for a couple of minutes to get a sneak peek of the types of things that I do in my work. I would love to be able to meet or talk with you in any way. So whether that's you leaving a comment, you sending me a message on social media, you sending me an email, any of those things, you inviting me to come to your church and speak, any of it, I am here for it. So as I said before, check out these sneak peeks.
Our spiritual health and our mental health are actually two very different things. I don't think is a conversation that is had often enough. And what that leads to is coming from that culture. There are a lot of churches, and I hope that this is something that is kind of changing in this day and age. But churches where they are encouraging people to kind of pray away the anxiety or pray away the worry or the depression or whatever it is or pray away addiction and things of that nature. Recognizing, obviously, I'm a Christian myself, that faith has an important part, but then it blocks us from recognizing the roles that medication and therapy have when we're thinking about addressing issues with mental health.
So one thing I actually want to talk about is the fact that in the US, depression is quite common. So 7% of adults in America have depression. So that's close to 1 in 10 people. So statistically speaking, in the group right now, we have 60 people here. There's a good chance that at least 1 or 2 people, if not at this very moment, at some point in their lives have struggled with depression. The important thing to recognize is depression is not necessarily lifelong. There are people who might have just one depressive episode. There's some people who have recurrent depression where they have multiple episodes over time. But ultimately, if you are someone who's connecting with care with your primary care doctor or with a psychiatrist, you will be able to overcome your depression with medication, with therapy, and with your spiritual health. And the thing that's really interesting to think here is 65% of people who have depression will seek help from a professional. And that is, again, going to your primary care doctor, psychiatrist, even a psychologist. And what to me is a little scary here is by saying that 65% of people seek help, 35% of people are doing nothing. And my fear is that in this 35% of people, a lot of us might be Christians who are afraid to reach out to help. And the literature actually shows that Christians are more likely, and people of faith in general, but Christians are more likely to actually go to a religious leader. So go to a pastor, go to a counselor in the church when they're dealing with mental health issues than they are to actually go to a primary care doctor. And I think that it's actually incredibly important to be able to feel that you have that comfort level to go to your pastor or to the different leaders in your church when you're struggling with mental illness, but at the same time recognizing that that is not enough, that in addition to doing that, reaching out to medical professionals is incredibly important.